Well, I'm here now with Rod Ross, CEO of MedLogix, and I just told him we're going to rock and roll this video segment, even though I have the violin, because Rod really epitomizes what our cover story was all about. You know, why, if Mozart were an ophthalmologist today, he'd be using the most innovative tools of our time, and really, when we're talking to Rod, we're talking not about innovation, but revolution. Rod has also shared that he's actually got this catapulse device, which has come into the posterior segment now, which I'm very excited about. Rod, take it away. What's so innovative about this device?
Well, I got into the phaco business in 1981, and we knew back then that ultrasound was a lot of energy in the eye.
Yeah.
And that's the cause of many of the cataract complications.
Right.
So we were trying to figure out how to eliminate, because to really reduce or eliminate the complication, you got to really get away from ultrasound and cavitation. So we've eliminated it.
Yeah.
And so we developed a high frequency pulse vacuum technology that actually, it has no outward energy. And so it's just a very focused energy at the cannula.
Yeah.
And so it has great followability, and we've used it in surgery prototypes for 7 years. 0 complications. We've never used the anterior vitrectomy.
Wow, wow.
You see, that's where cataract surgery needs to be. We've got to reduce and try to eliminate the complications. And patients want rapid visual recovery,
right,
small incision, and they do not, particularly private pay patients, they do not want complications.
You know, Rod, I remember the story you or your colleagues were telling me some time ago about how you were in a symposium and there were some different, devices. There were ultrasound devices, different things attacking cataracts. And there was some competition there saying, oh, I bet this is something like ultrasound. And you were just there shaking your head, no, it's not, no, it's not. Tell me more, what exactly happened there?
Well, there were 2 engineers from a very, very large company, and they were looking at the video and they said, yep, that's plasma.
Yeah.
And so I walked over to them, I heard the comment, I said, I'm pretty sure it's not plasma. I'm just about certain it's not plasma. And as they walked off, one of the guys said to the other, it's plasma. But what I was telling you a while ago, one of the things I admire about you guys are shaking it up.
Yeah.
You guys are really, and it's a stimulus
yeah.
to ophthalmology, and that's terrific.
Yeah. Well, we want to shake it up, but you don't want to shake it up,
right.
I mean, so to speak, right?
Yeah.
I mean, you've got this device that's just, I mean, I guess it must be very cool there in the anterior segment, posterior segment also, but because you're not using, much energy at all or no energy? How do you describe it?
The pulse vacuum is only an inward energy, but it basically interrupts the vacuum flow in such a way where the flow is greatly reduced because of the followability and the occlusion principle. But it's only focused at the tip. See, phacocavitation is outward, and it is a lot of energy. I worked with some former Cooper Vision surgical engineers. We took the phaco principle and applied it to orthopedics. And the energy, I can tell you could drill a hole through this chair with that kind of a level of energy with the size used in orthopedics. But it is amazing what cavitation can do. But phaco's been around for over 50 years. 50 years. So, and the only reason it's been able to survive is because nothing else came along that was better. And so now we've got something. I had the procedure done bilaterally 3 weeks ago.
All right.
The catapulse procedure bilaterally. And you can really approach bilateral surgery now with a catapulse because you don't have to worry about the re-sterilization and processing of a phaco handpiece. Because our handpiece is single use.
Wow. And tell me how you've decided to also move into other areas of the eye, like the posterior segment?
Well, we need to make these devices multifunctional. Things have to be more simplified, obvious, and effective. And so we figured out how to develop the catapults to where it doesn't vent like a normal phaco. One of the reasons you can't use a lot of these phaco devices for posterior segment work is simply because of the way it vents.
Yeah.
And so we made this device to where it doesn't vent, so you can use it in the posterior segment. And now we're going to expand its use for that, and we have 3 other applications that we're going to introduce. We're developing them today.
Hairstyling also by chance?
That's a consideration, and we'll probably have to start with me, but we'll get to you later. We'll make an appointment for you.
Yeah. Well, good. You know, I'm also a fan of your mind, Rod, and can you tell me how your mind works in terms of the process of innovation? I'm sure a lot of people would like to know, you know, how to do this. A lot of people working at companies, you know, as employed folks. How do you do it? How do you invent things?
Well, it's interesting. I've worked for the big companies. I won't mention them here on record because I used to give them ideas, and they would tell me, no, we're selling a lot of product. We don't need to spend any money on new ideas.
Okay.
But finally, I had an opportunity to start our own business. We've started several.
Yeah.
We've developed a number of devices through the years. And through the development of the catapults, I've come up with other ideas. And there's more technology coming. You'll see. I mean, the next model, it won't even have a vacuum pump inside it. It won't have a hanging bottle. All of that. It won't even have a cassette.
Yeah.
So, and we've got all of that patented. But how do you come up with new ideas? I'm going to write a book about that because, in part, it's you've got to solve problems, but don't just get stuck on problems. You've got to figure out how you advance the solution of problems. There's a thought process you can go through. There's something, what I call the cul-de-sac process, thinking process, to figure out how to come up with something new. Because you always run into a dead end at some point, trying to think of a new idea.
Right.
And so there's thought processes you can put yourself through to come up with something new.
And you know, I mean, I don't know what your background is, but it seems like, you know, engineers have great backgrounds in this field for innovation, but do you have to be an engineer to be an innovator?
I've never had an engineering class in my life.
Well, how about that?
I've never, I don't know how many patents I have, but I'm going to guess it's maybe, I don't know, maybe 25 or 30. I've never counted, but...
Some kind of good library in your neighborhood, or what?
No, but I've spent a lot of my career in surgery. I've seen a lot of calamities.
Okay.
And you just have to look for solutions.
Yeah.
And I mean, none of this comes easy for me. I'm a slow boat. I talk slow, I think slow, you can tell. And but you've just got to be relentless in solving a problem. And that's why it took us 7 years through doing surgery with the catapults to really refine it till it's really ready for the market. And it offers all of the clinical advantages that the phacos do not. Incision size 1.5 millimeter.
Yeah.
The patients, they love that. All patients want small incision. Who doesn't want a smaller incision? And the rapid visual recovery, all of those things. But to get those things, you've really got to eliminate ultrasound. And where did ultrasound come from in the beginning? It came from dentistry. Dr. Charlie Kellman, who invented phaco, that idea came to him in the dentist chair because ultrasound is what they use to clean your teeth.
I bet they're using something else these days in the dentist chair.
I'm hoping they do, because what would be older than phaco? I mean, but how much has phaco advanced through the years? It's really not that much.
Well, to use a metaphor, maybe it'd be like using a Commodore 64 nowadays to do computing work, right?
Right.
So, I guess it's about time for a change.
The phaco flip phone.
Right. That's the one.
Yeah.
All right. Well, so, you know, obviously we're talking, Mozart would use the catapults if you were an ophthalmologist today. Get it, got it, good. Anything else out there that you just see generally in ophthalmology as far as something that's really innovative that's happening right now? I
can't really pull anything up right now that I'd be aware of. I mean, I've seen a lot of things I would avoid, but I can't say that there's anything that's really that I've seen earth-shattering, except I must tell you, when I had my bilateral procedures, I had 2 multifocal IOLs that I'm impressed with those for sure.
Oh yeah.
I had the Symphony IOLs, and I had no idea that my cataracts were +3s.
Okay.
So they were
pretty dense, right?
Pretty dense, yeah. That's not the first time that term has been used on me, though.
Right.
Dense. But I'm impressed with the IOLs that he used in my eyes.
Right. Well, you know, for such a forward thinker, it's hard to think that you might have been a little myopic there for a time with cataracts going on. But
I should have done it earlier.
Yeah.
And that's where cataract surgery is going. People are having it done earlier now.
Well, you know, Rod, when you reincarnate as Mozart, just remember that. Get your cataracts out earlier, yeah?
I will if I can have that jacket.
Sold. Okay. All right. Well, we're here with Rod Ross and sure appreciate this talk on innovation. We'll catch you next time.